This video is about direct reduction technique for trochanteric fracture. In trochanteric fracture, achieving sufficient support of the anterior cortex of the femoral neck is a fundamental goal of the reduction. Subtype P in the lateral view can be a risk of excessive sliding of lug screws compared to subtype A or subtype N. Let me introduce the representative direct reduction method from anterior small incision using an elevator. Mark 1 to 2 cm incision line on the skin just anterior to the fracture site. In the surgery, first insert an elevator from the anterior incision and fill the fracture site with the elevator's tip. Then, check the fluoroscopy and insert the elevator into the fracture site with the curve of the elevator in this way. In order to insert the elevator nicely into the fracture site of subtype P. Let's watch a movie. Reduce directly, like this. It's not difficult at all, but there are a few important tips, so let me introduce them. First, put the elevator into somewhat medial side of the fracture site. You can see it in lateral view like this. Then, change the direction of the elevator's tip to elevate the proximal cortex nicely. At that time, the way you turn it is very important. You should turn the elevator in this direction because by doing so, medial cortex of proximal fragment will move to one cortex medial position. It's a preferable position to prevent excessive sliding of lug screw postoperatively. If you turn the elevator in the reverse direction, fragments can move to undesirable position. Let's see it again. Besides, there's another important tips here. When you reduce in this way, sometimes femoral head fragments come to retroverse and the fracture site ends up to be convex malreduction. To solve this problem, you should push down the thigh just distal to the fracture site, as the image shows. Please compare these images that of before push down and after do it. Do you see the difference? There may be just a little difference in this case, but this method will be super effective in some cases. Okay, lastly, let me show the old procedure. Insert an elevator, turn it 180, and push the thigh down on just distal to the fracture site. Keeping elevator in that position, install the short femoral nail as usual. Don't forget push the thigh down again when you insert the lug screw to the femoral head. This procedure is very effective and can be done in just a few minutes, so don't hesitate to do it when it is required. Thank you for watching. See you.